Hello everyone, a big warm welcome to all of you to this special episode on the Special Needs Children podcast. In this episode, I am delighted to have Beverly Louis and Gauri Shringarpure. Beverly Louis is the founder of Mann Center for Individuals with Special Needs and the co-founder of Karmann, a unique brand that designs and manufactures quilted products made by artisans with intellectual disabilities and autism. Through Mann Center, Beverly and her team help train young adults with disabilities, empowering them to secure meaningful employment and lead fulfilling lives, all while promoting physical and emotional well-being. Gauri Shringarpure is the Chief Program Officer at Mann, overseeing the mental health vertical. She is an experienced mental health practitioner who also specializes in gender and sexuality training and serves as a faculty member for the Queer Affirmative Counseling Practice course at the Mariwala Health Initiative. Gauri is a positive psychology coach conducting workshops on mental health and self-care. With over 25 years of experience as a consumer behavior consultant and researcher, she brings a wealth of knowledge and expertise. Thank you so much for agreeing to be part of this podcast.
Thank you for having us.
Yeah, pleasure to be here.
Thank you. So, diving straight to your first question to you, Beverly, what inspired you to start Mann? 15 years now. How did it all begin?
Well, I can say it was definitely not intentional to begin with. So, we are three co-founders, Dilshad, Gitanjali and myself. And I think all three of us wanted to do very different things in life. And fortunately, on different occasions, ended up at a place where we interacted with people with disabilities, and I think instantly changed our entire life's plan and decided to become special educators. And that's where we actually met, at the course to become special educators. And we had a project one day where we had to set up our own special school, and we had so much fun doing it that we joked about how one day we would have our own special school. And who knew that joke would eventually turn out to being a reality, and a reality that is now Mann. So that's where the journey began. Of course, it began with a very small thought, and a simple thought rather, that we just want to give them age-appropriate experiences, because we didn't see them out in society. We felt, that they also had the same needs like we did as young adults. They wanted to go shopping, go to movies, but why did we not see them out in society as often? So we said, okay, let's first start with providing them that exposure. And then from there, it grew into something bigger because we realized that they were so much more than that. They taught us that they were so much more than that. We were three, we didn't have enough of funds to run the program, and didn't have too much of support because our focus was on people who come from marginalized communities below poverty line, and that's how we saw 3 or 4 of our beneficiaries who started imitating us and helping us out as teacher assistants. They used our dialogues, they helped us with the ones who had higher support needs and had a better impact with them. And one day we just told them that why not, we'll make you our teacher assistants. So we gave them their first job. And I think seeing that transformation after we gave them their first job, how they would proudly come in every morning and tell us, today we traveled in the first class compartment and not in the handicapped. And we bought our own handbag and our sunglasses with our own money. Those little things, and we saw how their parents' viewpoint about them changed. They started respecting them more. And then we said, okay, we have to work on employment as a program, and built a new chapter of Mann.
That was lovely. Can you please tell what all does Mann do today? What all you've been, in how many places are you present, and how many people do you cater to?
So, that first program started with a group of 25.
Okay.
And just 3 of us training them. And today we've grown to over 100 trainers and support staff, a team of 100 with about 1,200 people who we are supporting. Again, we we built this employment curriculum in partnership with industry experts. So we went there as special educators. We didn't have enough of exposure on what skills are required in order to include them or help them build a career. And there was not too much available out there. So we said, okay, let's study what the industry demands are and then come back and create a curriculum that can be easily digestible by a person with a disability themselves, or a parent, or an organization, a trainer. So we came back, studied first with one industry. We went to the hospitality industry, spent 6 months there under the department heads, studied the roles, built the curriculum, and then they were absorbed by the first hotel, and then gradually every other hotel wanted to employ them. Similarly, we did that with the next, we did with the corporate industry and studied the roles there. And today we have 9 different industries, the most recent one being the banking curriculum that we've added. And the curriculum is growing. Every year we keep studying the emerging trends and the new standards and expectations, and we add that and adapt it. Wonderful. And of course, that's the training part of it. And we've also learned that mental health is such an important part of making this successful and providing the support to the individual and the family and the employer and society at large. So while we train and provide mental health, and the eventual goal is always employment and standing on their own feet and building their own self-esteem, and eventually inclusion into society.
So how many centers do you have now?
So this curriculum we now share with 13 different organizations. So we've partnered with organizations that are working in the space. They want to get into employment but really don't know how. So instead of gatekeeping this curriculum, we said, why not collaborate and share it, provide them the training and the support that they need with if trainers, or in terms of mental health support or employment and placement, or all of it. And that's how now we have 13 different locations, 1,200 students and people using the curriculum, training, graduating as we speak.
Locations across the country.
Yes.
So,
yeah. So a batch of students would, get employed and placed in how many years?
The duration it depends on the individual's ability, and that's why we don't have a fixed duration. But typically the program goes on for at least a year. Sometimes it may take even 2 or 3 years. And that's how, the duration, and it's an 8-hour program for the whole day. And we work on like Monday to Saturday, and we don't have any vacations. So we get them, used to how they will have to eventually, step into or transition into a workplace.
So who are the kind of students who are coming into Mann? What are the kind of disabilities, or what are the kind of skill sets, challenges? Are there different, they might be across the spectrum, right? So do you cater to a different, what is the skill set that you're catering to essentially?
So we don't have any specification as such. We are catering to people across the spectrum. Across the spectrum, the focus is on finding what their interests and strengths are, right, and building around that to make them of value to somebody, to some organization, and even for them to value themselves and feel like they are a part and they are contributing to something. So it depends on what their interests are. We identify that through an extensive assessment, that we do. And then after that, we build on that through the training program. So there are people who can eventually graduate and transition into a workplace that they will go to. But there are those also who we bring the jobs to them. They may not be able to go to a workplace or be included because of the extent of support that their disability demands. So, but that does not mean that they are not talented and skilled, and that does not mean that they can't work and earn a living. They may need to do it in a supported environment. They may need to, manage their emotions through the day. They may need to have breaks. So that is the kind of support we provide them through this brand that we've started, Karmann. So Karmann trains, so at Mann we train them in manufacturing and production related roles, and then they are absorbed by the brand, and they're doing everything right from designing the product to manufacturing to packaging, logistics, dispatch, all of it.
And how does one get to know about Mann today? How do your children come? How do the adults come?
Through word of mouth. I think every parent knows another parent and wants to share that experience. I think parents also, they have a lot of conversations within their networks. They're a part of support groups. So through that, they share and parents come.
Okay, thank you. Thanks for sharing all of that. I'll come to you now, Gauri. I know that it's very difficult what you're doing, but could you please share with us more about your journey and what led you to focus on mental health first, and particularly in the context of intellectual and developmental disabilities and autism? What is it that led you here?
So I'll make my history and journey brief, and I think I'll focus a little more on how I ended up in Mann. So I come from a field of consumer behavior. So for the longest time, I have been part of that. And as you know, when you're talking behavior, you're talking psychology. So and around 20 years, more than 20 years, I've been in that field, and the mind always fascinated me. So that's how I actually landed in this sphere, or this field of mental health. Um, but what happened and how I landed at Mann was completely accidental, honestly speaking. I think accident seems to be the theme of Mann. But so I was as a consultant with Mariwala Health Initiative. So I was doing their course, as you already know, their queer formative counseling practice course. So while we were doing that, I was asked whether I could sort of help Mann to set up a mental health program. Actually, it was not called a mental health program back then. We were thinking of it as a family intervention
program.
because back then, and that time, Mann was not as big as it is today. And I'm talking 2018. Yeah, 2018. Yeah. So back then, what Mann realized was that the caregivers of the beneficiaries, they are struggling a lot in terms of, because as we all know, I mean, when we are looking at caregiving aspect of people with disabilities and intellectual disabilities, the levels of stress that caregivers experience are phenomenal, and they are not acknowledged. It's a thankless almost job. I mean, quote unquote thankless, but yes. And while that was happening, they don't get any kind of support from the society or from anywhere else in terms of dealing with their stressors. So I think that was the initial thought when we were approached, and that's how I landed in Mann. And the first thought, of course, was okay. We have to look at it as from a family intervention perspective. So but when I came there and when I started actually talking to Beverly Louis, started looking at the program, started looking at the beneficiaries, it was clear right away, I think in the first week itself, that this is not a simple spotlight on caregivers that we need to do. And that's when actually the entire, almost like a project started. We actually did an extensive study. So I mean, we did a lot of home visits. We tried to understand the trainers. We started to look at how beneficiaries would be, benefited most by giving support from various angles. And what we finally distilled this into was the fact that we need to look at this more holistically. We need to look at it from a 360-degree kind of an outlook, where we said, okay, let's keep the beneficiary in the center, and let's look at the ecosystem, and let's look at giving support to the ecosystem. And when we said ecosystem, everything came into it, and right from the trainers to the caregivers to the helpers to the founders, anybody who is in touch. And when I'm saying that, it became there were internal stakeholders as well as external. So internal obviously is all those people who are in touch with the beneficiaries, but external meaning the employers, the public service providers who are in touch with the beneficiary. Like for example, they travel, so maybe the auto drivers or maybe the BST drivers. All of that, everybody had to be sort of touched or supported. That's how it began, and then we started thinking of, okay, when we are saying supported, what do we mean by supported? And that's how we started looking at mental health support, because unless the mental health of all these stakeholders are taken care of,
Right.
the beneficiary's mental health is not going to be. And yeah, so when we're talking about people with disabilities or intellectual disabilities, um, it's not easy to do, like, okay, I cannot say, okay, let me do like a one-on-one session with you and things get sorted. It's not going to be that. So a great part of their mental and emotional well-being depends on the people they are interacting with. And that's how we actually put this entire mental health program into place. And it was a very, very structured one. Finally, we came up with a manual in which all of this was put down, which we also like template in the organization that we are partnering with. So if it's individual sessions, group sessions, sensitizations. So we've thought of a lot of things there, and that's why I think we pride ourselves in saying that the mental health program in Mann is not a supportive program. It's a vertical in itself. So we have the training vertical, we have the employment vertical, and we have the mental health vertical. And it's given equal importance, which I think is great. And I think what Mann has always been is very open to ideas, trying out new things, and this was something which was very new to them. And they were open to it, and I think we are seeing the results now.
It's been a game changer.
It's been a game changer. Really, it's been
very, very interesting to know, and I'm sure that this is going to benefit a lot of other organizations also, who are in the same space, and might definitely lead them to also think in this aspect, right? Yeah. Coming to so therefore, specific healthcare for adults with disabilities and autism is the space that you are currently in. So, what is the ideal mental health support system that looks like in this context? Can you please share a little more?
So I'll just sort of continue from what I was saying earlier to make it a little more nuanced. Yeah. So again, if you're talking about mental health support or emotional support, we are talking about very, very targeted support to the beneficiary. So when we say that, we are talking about actual sessions with them, like one-on-one kind of sessions with them.
To top it, you are also doing it specifically for the marginalized community.
Marginalized communities, yes.
Yeah.
So we have
it must be very different, and
it is. So what we do, and I think that's the best part of this, because when we are talking marginalized communities, we are talking about certain stressors which are so unique to those communities. So when we are saying that, again, what we are talking about again is coming from financially slightly underprivileged backgrounds, educationally sort of lesser strata. We are talking about marginalized religions, minority religions. So all of this, minority castes, so all of that and their unique stressors. So for that, a very different kind of mindset is required. And I think that's what I think we have tried to inculcate in our organization, where we need to have the perspective that, okay, these are populations that are anyways underserviced. They are as it is marginalized. We need to do that little extra so that they can be elevated to a level where we can give them all the kind of support that we can in terms of helping them with, say, for example, if I know that there is this beneficiary and raised by a single mother who is working as a house help somewhere. Now, just to give you an example, because I think that will be an illustrative example would be helpful. So for underprivileged, people coming from an underprivileged background, mental health itself is something which is, I don't even want to call it a rarity. It is something that you don't even hear of. So for us, you have to start from there to actually get them to the point that, okay, it's important for you to also feel good.
True.
So that you can take care of your children better.
Yeah.
So to begin with, what we started doing is we started actually calling parents for one mandatory introductory session, and they were clueless as to what this is all about. And we come from a society where parents teachers meetings is the norm. So here, when you're talking parents teachers meetings, it's about complaints about the child. But when they actually came and attended, had that one session, it was a game changer for them, because they realized, when I spoke about my struggles, about how I am, trying very hard to raise my child, plus also to make ends meet, and all those struggles are being acknowledged in this space. I feel so much relief. I feel so heard. It they I mean, I think for them it was something that they had never experienced.
Yeah.
Suddenly they found a space where people are actually listening to them, understanding their struggles, and then they realize that is actually it's getting translated into how they are interacting
Interacting and
with their
behaving with their
with their
Yes,
beneficiaries.
I heard a very a very touching one story which I'll just share with you, that so this mother says that when I go stand in the line for the ration, okay, I know that मुझे ज़्यादा मिलेगा because मेरे बच्चे के लिए वो allotted है, लेकिन मेरी जो community है वो मुझे उस line में खड़े रहने नहीं देती है, क्योंकि उनको पता है कि वो मेरे बच्चे के लिए मुझे ज़्यादा राशन मिलेगा. Now this is so specific and so unique, and who will that mother go and tell that to, and how will she land up getting her true due of what? So even if the government is trying to do something, what is the community around doing for her? How are they accepting, and how are they helping her in that? So I'm sure that you come across a lot of these.
In fact, we've heard so many stories about, okay, as I think, as a culture, or the mother is somehow the needle points to the mother when it comes to blaming. So as it is, they are under this tremendous guilt, that is because of me, that the child is like this. So and then again, like you very rightly said, where do they go and who do they speak with? Because otherwise the family is so-called, it's a place where you get the support that you need usually, but in their case, that's not available to them. Which they suddenly started realizing that, okay, when I come and talk here, somebody is listening. And I think I would want to make this mention here, that when we are doing our sessions, one of the first things that we tell them is, we are not asking you to come here to speak about your child. We want you to speak about yourself, and you can talk about anything under the sun. Even if you don't mention your child in this session, it's fine. And that is like, oh, really? And there are so many of them who are actually now asking for sessions, and it's an ongoing thing. It's by on demand kind of a session that they ask for, and then they ask and they come.
And I think even for our teams, for all of us, it was, and I'm sure the same for many parents. Like for the first few sessions, we just sat there and said, now what do we say? Like, ab kya bolu? Because all the time you're focused on that child, on working towards getting them there. What do we do for that individual?
No,
But
and
never realize.
it's so important because if the school and wherever the center that they're going to is only focusing on the child, what all is actually happening back at home, nobody is even addressing that or even talking and asking them to speak. You genuinely don't know what's happening at home, and what all is affecting and impacting. So this is brilliant, what you all are doing, and I'm sure that it is helping all of those families to be more open and to be more vocal, and then they can also stand up for their rights, and it leads in a particular way where you're handholding them to say that, okay, it's fine, talk about it.
And now they are advocates for other parents who are feeling the same thing, and they tell them and reassure them that, what, I felt exactly the same, but go through the process.
So we do have these periodic peer meets of parents, and then they share their experiences, and then it's become a community now for them. outside of Mann, so they
Correct.
can actually
Which is brilliant. So it's a
rely on
parent
each
support
other.
group
Peer support is
capability, yeah.
something that is worked also brilliantly with them. So yeah, these are a couple of things that we do. I mean, we do a lot more, but I think these are things that sort of tells you what goes on.
Yeah. So coming to you, Beverly, now 88% you said of your entire the adults whom you're catering to are from the marginalized section of the population. So where do your funds come from, and how do you go about doing this? Who is helping you all, and what's going to happen in the future?
So it's 100% based on donations. Funds are raised through CSR support, through foundations, philanthropists, individuals who are willing to help, and that's how the program runs. Of course, being 100% dependent on donations is not the most sustainable thing, but fortunately we have people who have also encouraged us to build a corpus.
Right.
So that's something that we always do. And besides that, we are also working towards making the program sustainable. So our goal is eventually that Karmann becomes profitable, and then the profits are plowed back in to support the training activities of Mann. And we are on the road
So
to
would
doing
you like to please share about what all Karman is into, and how does Karman and Mann, how do they work together or separately?
So Karmann is a separate company. It's focused on, it's almost like a business that we that employs people with disabilities for all of the roles that we have within it. So as a brand, our focus is on upcycling fabric that's typically going to waste. So we almost look at it like the people with disabilities who were considered not useful and who were considered as, being waste. They can't do anything. Just like the fabric that was, discarded or not useful. And we kind of give both of them a new life by, they create the product and they use the waste fabric and they make a new product. So we do a lot of corporate gifting. We also do a lot of job work for different brands. So we sell under our own brand. We do work for other brands also. And the focus will be always on upcycling and using up fabric that's typically going to waste.
So where is your unit and where all are you present?
So as of now, we have one manufacturing unit in Goregaon in Mumbai and one in Srinagar in Kashmir. Yes, so that is through the partner organization itself. We partnered with Voluntary Medicare Society in Kashmir, and they graduated after the training program, and now we've set up a manufacturing unit there.
Lovely.
So we have a group manufacturing there, and soon one in Gujarat as well. So in one of our other partners, Munni Seva Ashram. So it's a home for girls with disabilities. So they are soon going to, within a month or two, set up a manufacturing unit there as well.
Wonderful. So what happens? So the individuals in Mann, do they go to Karman? What is the progression?
So everyone comes to Mann. Then we identify what their strengths are. So if someone is interested in hospitality, they do the hospitality training. If someone, then they eventually get placed in a hotel. We help them find a job. We provide them with on-job training support, so post-training support. And once they are placed, we also ensure through the mental health team that the corporate is sensitized, the teams are sensitized. We have events and workshops for them consistently, and then the individual is settled in the organization, and as and when they need us, they call us. So most of the time they don't even need us. They literally, when we call them even for a social event, they say, no, now I have friends, it's okay, no, which is wonderful, but we say, okay, we need you, please come back to us, at least sometime to show us your face, because we miss them. But and then if someone can't, their industry or their choice or their strength is towards creating something, then they work at Karmann. So we train them first into the manufacturing and all the skills related to that, and then they graduate and they get a job at Karmann.
So, the way you mentioned hospitality as an industry, which are the other industries that are open to looking at our adults?
So many. We have retail, the food and beverage, that's all of the restaurants, the restaurant sector. We have the corporate sector, multiplex. What else am I missing?
Uh-huh.
Banking, yeah,
Yeah.
banking. I did mention those. So these
They
are
have some consultants, MNCs also. Yeah, this is
yes,
office corporates basically.
corporate I mentioned. Yeah.
Yeah.
So, Gauri, then what are some of the key areas where the mental health organizations, governments, and communities, where can we collaborate more effectively and, to create a lasting change in the mental health care space?
I have a couple of thoughts on this. Yeah. Uh, okay. I think at the outset, I need to say that when we are talking about the developmental sector and we are talking about disability in specific, mental health per se is not being given so much of importance. Um, how I would like to really look at this is, of course, we have the Rights of Persons with Disability Act, all of that is there. I am not very sure how much of that is being really implemented on ground. So I would say that one, of course, there needs to be a more conscious and active, almost like a feedback loop there, because I don't know whether all NGOs that work in this particular field are even aware of the kind of facilities or schemes or that the government has already declared for people with disability. So mental health per se is stigmatized. I mean, looking after one's mental health is stigmatized. So probably working with the government to have mental health programs specifically for the people with disability, because the stressors are so unique. So maybe have certain programs in place, a certain accessibility of mental health services. That is another thing, because when you're talking about mental health services, they don't come cheap. In Mann, obviously it's free of cost, but if you're trying to access them outside, it's not easy. So maybe there are some subsidized ways of doing this again more actively. So government needs to probably also think on those lines in terms of policies. Uh, uh, Maybe even mental health organizations. So again, uh, disability, the entire disability landscape, if we see, invisible disabilities are really invisible. I mean, even in terms of mental health, because people would look at, say, more, the locomotor disabilities more, or probably the speech hearing impaired more. So, whatever, I mean, like we keep saying that even if you're looking at the icon of disability, you see a person on the wheelchair. So, and that's why, and that has sort of fed into people's understanding about what disability is. So, even mental health fraternity also, I mean, there aren't too many takers to look at mental health of people with invisible disabilities like what we are dealing with.
Right.
So again, a little more awareness there, advocacy there is important. And I think and I think also to talk about more community based awareness. So maybe having sensitizations, maybe awareness programs in specific communities. It's a huge task and a huge ask, but it needs to be done at some point, because if the mindset has to change, I think advocacy is the way. Visibility is the other thing. I mean, how much visibility does mental health of disability may have some amount of visibility now, but the mental health aspect of the people with disability is, I think,
I think just what you're trying to say is that people even acknowledging that if there is disability, there is definitely the mental health has to be addressed for the individual and for the family to be able to help them lead.
I mean, as much as I mean, if you look at physical health has got so much of. I mean, people do think about physical health so much. What about mental health? Yeah, completely ignored. It doesn't exist.
Thank you for that, you know, extensive sharing about mental health, Gauri. Very important. Coming to you, Beverly, what are the future plans for Mann and Karmann? Can you please share how does the next decade look? Where you headed?
For us, I think the capacity building piece, I think sharing this curriculum, sharing the best practices, all of the mental health aspect, the employment aspect, all of the verticals that we're doing, building capacity within other organizations and seeing that work and seeing the program grow and being able to bridge the gap between access, training, mental health and employment for people with disabilities who actually need it. That's the goal, to reach as many as we can, and hopefully our eventual goal is a world where our services won't be needed, but let's see. Long way to go.
So thank you so much, ladies, for sharing so beautifully about your journey and about what you all are doing. Thank you for doing this for so many individuals and the impact that you're causing among so many families. Other organizations who are here in this space will be learning from you, and I'm sure that they find this very very engaging, and they would understand why this space about even mental health is so important to go in sync with the services that they are offering. Uh, Wishing you all the very best, wishing the entire team all the very best in terms of growing. We need you. A lot of people out there need you. Many people who don't know about you, please, can you please share how do they reach out to you, whether at Mann or Karmann? How do they contact you?
I mean, I can leave our numbers, and then also through our website, we have a.
So I believe Karmann is a e-commerce.
Karmann is an e-commerce portal, so any kind of products that you want to purchase, you can go directly to the Karmann website.
Which is KARMANN, right?
Yes, .co.in.
.co.in. That's wonderful. So I know I have been using a lot of Karmann products. I've been gifting them to everyone, and everybody loves it. So including my own family, my sister-in-laws, everyone loves everything that you make. And it's very innovative, very colorful, and very soft. So I know that you've been the sustainability part of it, the recycling, upcycling of fabrics. It's just beautiful. I would strongly urge people to go learn from them, visit their manufacturing unit also. It can give you a lot of ideas, I guess, and make you also perhaps help and support them, because they're doing some real wonderful work. So thank you so much for being on the show, and wishing you all the very best.
Thank you very much. It was lovely being here. Thank you.
Thank you so much.